2, start.
Hello everyone, welcome back to the Future Talks conducted by Prayaana. I'm Aishwarya and I'll be your host for today. Let's begin the session with a small introduction to Prayaana. Prayaana, a unique employability, entrepreneurship, and innovation ecosystem for women. Prayaana Lab gives wholesome career support services right from career counseling, training, mentoring, and recruitment services under one umbrella. In case you're a girl out there who's in your graduation or post-graduation and trying to enhance your skills for recruitment, this is a great platform for you. In case you're a professional who's trying to upgrade your skills upgrade your skills at your workplace, this is still the right place for you. If you're trying to come back to your career also, you can just get enrolled with us. Check us out at www.prayaana.org. If you like what you see, you can register by joining us at www.prayaana.in or download the Prayaana app. It's a community hub where you can network, share your thoughts and queries with women of similar interests. We provide you mentorship program and learning modules over international and well-acclaimed mentors. So definitely check out our app. This is Prayaana Collective. It is a venture of Prayaana. It is unique in the attribute that it is India's first e-commerce platform that is dedicated for the empowerment of women. If you're a woman entrepreneur out there who's trying to expand your business or customer base and trying to promote your products, our platform is definitely suitable for you. The platform is uniquely designed with an attractive affiliated marketing module where all the customers are given an opportunity for lifetime savings and earnings. So definitely check us out at www.prakol.com. So in case if you have any queries with the session, you can feel free to post it as a comment in the live chat box below and we'll get back to you at the end of the session. Our today's session is on the topic, Everything You Need to Know About Dental Care by Dr. Meera Prashanth. Dr. Meera Prashanth is a chief endodontics and cosmetic dentist at Dr. Meera Smile Dental Care, Vettile, Ernakulam since 2006. She's the founder and CEO at Dr. Meera's Dental Academy, Kochi. She's the present chief editor for JIDAK, the official online scientific journal for Indian Dental Association, Kochi branch. She has completed her BDS from CODS Davangere 2002 and MDS in Conservative Dentistry and Endodontics from Savita Dental College and Hospital, Chennai in 2006. She's a former professor at Indira Gandhi Institution of Dental Science, Kottamangalam. She's also the former co-editor of Journal of Ontological Research. She has won the IDA Excellence Award in 2008 and also the National Award for Best Editor in 2019 JIDAK Journal. She's a member of American Academy of Cosmetic Dentistry and also she's the executive committee member of Academy of Cosmetic Dentistry in India and an executive committee member of IDA Kochi since 2005. She's the former president of Women Wings IDA Kochi. She's conducted several continuous dental education programs at the district, state, and national level. A warm welcome to the show, ma'am, and over to you.
Good evening, all. Thank you so much, Aishwarya, for that lovely introduction. I was also in awe of, seeing what all good deeds Prayaana is doing for the women community. And I myself would love to enroll in it and be a part of it and, encourage or at the same time get encouraged along with you. Thank you so much for the platform. And today I'm here to speak about dental care. Okay. Talking to a general public about dental care, first I need to make them understand how important or why is it important that we should take care of our teeth and the dental apparatus, not only for our own. See, I've always believed that when you educate a man, you educate an individual. But when you educate a woman, you educate a whole family. So a big salute to all the women out there who has taken time to associate with Prayaana as well as see all these programs as well as, go ahead and encourage your family to towards the betterment of the family as well as the community. So let me put in my tidbits of knowledge into this platform and tell you how all or why is dentistry so important in our life. Why is maintaining good oral health important not only for you, but also for our children, our family as a whole? So let me start, as you know, seeing is believing. So rather than just listening to things which will actually make you imagine a lot of things, and too much of imagination, you might not be able to actually imbibe what I'm trying to tell you. So I would like to put in a few slides, a few schematic pictures, which will help you understand the concepts that I'm trying to speak better. So give me a second. Yes. All of you would agree with me, right? If I tell you that a thing of beauty is joy forever. Who doesn't want to look beautiful? Everyone does, be it a baby or be it a toddler. You have seen toddlers spending hours in front of the mirror, and from that age, everybody is actually very much aware or very much wanting to look good. The way we want to look good ourselves, when we actually meet a person, the studies have proven that 67% of the people actually first notice your smile. Okay, it is a fact that 65% of people actually notice your smile. So if you have a good smile, there, bang, the first impression that you make with the person you meet is already done. Okay, so let's see how important is teeth in your looks. Of course, when we see our baby smile in the first 6 weeks of life, that is the biggest joy a mother can have. But is it always so? This is our Miss World to you. Without teeth, this is how she would look. So, this is just to make you understand the importance of having teeth and importance of having beautiful teeth in on your face, so that you make a first impression. Be it the Miss World or the President of America, teeth are important. Okay, that's just for your looks. Now, it's not just important that you have teeth. You should have good teeth. If you don't have good teeth, what you need to do is try to get them corrected as early as possible, because a small correction done in your smile itself can do wonders. This is the same person grown up before correction, and after correction, you can see what it has made him do. Okay, so smile correction done on you gives you a lot of confidence. I am just bringing up these topics and pictures just to make you understand how important your dental apparatus is, both in your looks as well as in your psychological development. Now let us see, why is it important that you should be aware of the dental health? Why? First of all, health. Teeth, like any other tissue in your body, is an important organ which has a lot of functions. It helps you to eat and eat well. If you don't have teeth or you have painful teeth, the amount of food or the quality of food that you will be eating and the way you chew also influences the amount of nutrients that would be absorbed into your body, because digestion starts in the mouth. So unless you chew and mix it properly with saliva and gulp it down, there are certain certain nutrients that would go unabsorbed. Okay, so one is health. For proper food, for proper health, you need to have a good dental apparatus, as well as the gums and the other tissues in the mouth. And for speech, it is very important. It is very important. You can always say that our S's and our F's become more long if you don't have properly structured front teeth. When the child is actually growing up, that's when he learns his syllables and his phonetics improves. At that time, if your apparatus is not proper, or if you have not corrected a particular habit that is there in the child, like a thumb sucking or a tongue thrusting, etc., you'll see the pictures later of that, it can affect your speech. So both health and speech. And last but not the least, beauty. Yes, we are in a beauty conscious crowd. Your teeth speak loudly when it comes to beauty. Now let's see. Let's start from our childhood age. What all do we need to be aware of with regard to our teeth and our mouth, and the size of our teeth and our mouth, and the look of our teeth and our mouth? So let's go to baby tooth care. Mothers do ask me, how much or when should I start brushing? Or my kid's teeth have not come out, doctor. He's already 7 months old. It's not come out. Do not worry, it has to come out. Where will it go without coming out? Maybe, like, since we are not like in the earlier times where we used to start feeding the child a little more early. Nowadays these formula foods and ready-made foods does not probably stimulate the gum pads enough. But even if it is coming at 6 months or 9 months, it does not make much difference. It will come, just don't worry. Okay. Now, when do I start brushing? You can start brushing as soon as the small baby little teeny weeny teeth come out. Okay. But may not be with a toothbrush. You will have brushes. Those brushes are available which fits the finger of the mother. You can use them gently and wipe only the tooth surface. Don't wipe the gum pad area, because or repeated wiping of that can injure your gum pads of the baby. Or you can use a small wet cotton piece just to wipe only the tooth surface. Okay, that's about baby teeth. And now this is one common sight when it comes to a toddler or child less than 6 years. We say that it is not just one tooth or two teeth that is decayed in a child. We see that several teeth are decayed. At times we see that the child walks around with broken upper front teeth. Now, what is the cause of this? Now, these things are better avoided or prevented than treated. Okay, so now for that we should know, why does this occur? There is another beautiful name for this disease. It is called nursing bottle decay or baby bottle decay. This happens because of the baby's habit of feeding on the formula in a baby bottle, or even breastfeeding, and throughout the night, or he sips into the bottle and sleeps off. So what happens is that the entire night, either the formula milk or the breast milk is pooling around the neck portion of the teeth. Okay, so that is why the decay comes at the neck portion. By neck portion, I mean the junction of the tooth and the gums. The junction of the tooth and the gums. So in these areas, the milk pools, and that is where the decay starts. And once the decay progresses deeper, this tooth just snips off at that area. Now, how do you understand whether it is baby bottle decay or any other decay? What you will classically notice, is that the lower front tooth are healthy. The lower front teeth, maybe 3 or 4 teeth, they are healthy. All other teeth in the mouth are affected. That is because when the baby latches onto the nipple, he keeps the tongue on top of this 4 front teeth. That's how he gets the seed and he starts sucking. So these 4 teeth are saved from the contact of the milk. The milk contact happens only in the upper, or the entire upper teeth, and the lower posterior or behind teeth. So if you see that these 4 are okay and everything else is decayed, the cause is baby bottle decay. Now, how do I prevent it? So whenever I feed my baby, just take a decision like this. Whenever I feed my baby at night, and after, he has had his fill of milk, make sure that the last 1 ounce or half an ounce that he drinks is water. Okay, just change the bottle and put a bottle of water, so that whatever stays or pools around the teeth the entire night would be water and not milk. So that can actually wash away the milk that is staying in the mouth, and we will not have that sugary liquid on the teeth, which causes that decay. So I hope that's clear. Now let's come to a little more older children. When a child comes with a decay in a primary tooth or a milk tooth, the blue colored ones here are milk teeth and the white ones are permanent teeth. Let me tell you, from 6 years to 12 years, a child will have both primary and permanent teeth in the jaw. So if at all one tooth is decayed, very badly decayed, don't sit with a premonition that of course that is going to fall off. Then why I should worry? Anyway it is going to fall off. Why I should take fill that or take it to the dentist and things like that. No, that's not the thing. Maybe the tooth that is decayed is this one which erupts. This is the permanent first molar which erupts into the oral cavity by 6 years of age. As the child's jaw starts growing forward, molars start erupting 1, 2, and 3 behind. And when the primary teeth molars fall off, it is the premolars that come out beneath. Suppose one decay happens and this tooth falls off, or you get it extracted by a dentist earlier than usual. This tooth actually has to stay in the mouth till 11 to 12 years of age. In case it goes off earlier, what happens is that the permanent tooth is already here, okay, and there is a space, okay, and we have a better picture here. Suppose there is a decay. Suppose there is a decay in this particular tooth, okay, this particular tooth, and there is infection, and somehow we have to remove that tooth. So what happens is, this is the permanent succedaneous tooth that comes out from beneath, and this would come only by the age of 12 to 13 years of age. Before that, this tooth is here, and even maybe the other tooth is, the tooth in front is also there. Suppose you lose this tooth early, what happens is that this tooth can tilt to this side, or this tooth in front can take up the space and come out through this place. So when it is time for the permanent tooth to come out, he gets locked inside and either comes out through the right or the left, and it isn't pleasant either, as well as it does give a lot of problem in function. So what should you do when you have a deep decay in a milk tooth? You should go to the dentist, get it fixed, remove the infection, fill it to the actual form of the tooth, and let it function. The child will be able to chew also on it. There will not be any pain, and it will naturally, just like how it would have fallen off if it was not decayed in the first place, it would naturally fall off, and you can have a healthy dental apparatus. Okay, so now once you do that, you just have to cover it with a small stainless steel crown, we call it. It's a restoration to hold all the tooth together, so that the child will have it and will be able to chew on it till it falls off naturally. You can either have steel crowns at the back, or if it happens in the front, you can have tooth colored small caps for your teeth after getting them treated. So just remove the infection and treat it. In case you have to extract also, what you need to do is place a space maintainer. These are small appliances or small rings like substances fixed onto your teeth, which will maintain the space there without allowing the other two teeth to migrate to that space. That's why it's called a space maintainer. Just get it fixed till you start seeing the beneath teeth coming out a bit. When you start seeing that white spot of the beneath the tooth, the permanent tooth that is supposed to come there, once you start seeing that white spot, you can go to the dentist and get this removed. So you are trying to save or maintain the space and get a good bite for your child once he is growing up. Now, the next preventive thing that you can do for a child from the age of 6 to 12 years is that at this age, the teeth are newly erupted. The kid is still not very serious about his cleaning habits. Plus, the deep grooves and fissures on the tooth structure are a little too deep and slightly immature teeth. So at that time, the chances that these fissures can get decayed is more. So what you need to do is just seal off these fissures with the dentist. Go to the dentist and just seal off these fissures. No drilling, no filling, nothing. These are fluoride releasing materials that can be used to seal these fissures Remember when I say this is a preventive technique so that you can save the tooth of your child from getting decayed. Okay, now many people have witnessed this. Every child sucks his thumb when he's a baby. Okay, and slowly he learns to like wean off that habit. But certain children cling on to that habit for a longer period of time. Now, this is a habit that actually holds the muscles around your teeth and of your facial muscles uh, very closely, and you know suction pressure is also there. So at that time what you have to understand is that the jaw bones, the upper jaw as well as the lower jaw and the teeth, everything is in a formative stage, nicely moldable stage. So if there is excessive pressure that is coming from outside, the arch, this is what we call the arch of teeth, tends to get narrow. Okay, so this habit has to be weaned off by 2 years of age. If it doesn't, there are several steps which we can take to like you know stop the child from doing so. From simple things like painting the child's thumb with some bitter liquid, or fixing some appliances in the child's mouth so that that habit is broken. There are several appliances. This is an appliance that prevents thumb sucking as well as a habit called as tongue thrusting. Some people have the habit of putting their tongue in between their upper and lower front teeth, often just like as if they're jutting out their tongue in between while they are speaking. So that can affect the front teeth, making them to come out, flaring out with gaps in between teeth, etc. Okay, so these are all habits. And mouth breathing. Mouth breathing is one habit which you can easily make out when the child is sleeping. They will have their mouth widely open. Now, should it be corrected? Yes, it should be corrected. But first, what we have to make sure is that her or his nasal airway is clear. We would have to have an ENT consultation also. If it is just out of habit, there are habit correction appliances. This is one simple appliance called as a oral screen, wherein we put a screen inside the lips, outside the teeth, with lots of holes, and they can easily breathe through the holes. And slowly we'll start plugging one by one, so that the air available through the mouth becomes less slowly, so as the child is slowly habituated for breathing through the nose. So there are several appliances for several habits like this: tongue thrusting, mouth breathing, thumb sucking, lip biting, etc., etc. So these are a few. Okay, so let's go to now. The child grows a little more, and every child now, this braces treatment, this is what we call orthodontics. The braces treatment is somehow in the present age, we can call, in the teenage group, it's become a fashion statement as well. If my friend has it, I also want it, kind of. There we do receive patients like that. But first you need to meet the dentist and see, whether it is actually needed for you. If it is actually needed for you, when is the time for the first orthodontic appointment? Usually what happens is, either the parents think of the convenience and let the child pass the 10th standard and then they come, because that is when the child is free and you can do all this stuff. Or they feel like, once all the permanent teeth are out, then we do it, etc., etc. But let me tell you that the first orthodontic appointment has to be at the age of somewhere between 7 and 9 years. 7 to 9 years for girls, and maybe 8 to 10 years for boys, maybe one year older, because their growth spurt comes a little more later. Now, why that is so? Because that is the time when your bite is actually developing. The teeth are erupting and then coming into a relation between each other. That is what we call a developing bite. So at that time, if you have crooked teeth, if you have a narrow arch, if you have some habits, etc., etc., all that can affect the position in which your teeth come out. Okay, so if we were to wear some harmless appliances, okay, these are all removable appliances This is just a soft screen that can be worn in the mouth. That too not full time, maybe night or maybe around 10 to 14 hours a day. You don't have to wear it when you go to school. Only when you are at home you need to wear it. And it is not painful, absolutely not painful. It just guides your jaw to close properly. It just keeps away unwanted forces from acting on the teeth and jaws. It helps in positioning the jaws in the right manner so that the muscles of the child itself guides the jaw to grow properly. So these are the things that, and such appliances are called in dental terms interceptive orthodontics, which is actually we are intervening in the growth of the jaw and letting it grow properly so that the child gets a pleasant appearance and a beautiful bite. Let me tell you one small example with this picture. You see the upper jaw and the lower jaw. They are growing at different rates. So what happens? This jaw is growing a little faster and this little jaw or the lower jaw is not able to catch up. At this time, if this child is allowed to grow like that, he's going to have a really small chin and a bossy upper teeth. Okay, that's not so. If he wears some small appliances or removable appliances at the age between 7 and 11 years, we can correct it. We can guide the lower jaw to go a little slowly and lower jaw to come up a little more faster, and the upper jaw not to exceed the growth rate. So that way we can. So this is the change that comes in the child's face with if you take timely treatment. This is called interceptive orthodontics. So what is the takeaway from this? I'll show you one more picture. This is the reverse. The lower jaw is growing at a faster pace. At 7 years, 8 years, it becomes evident for the parents. At times, it's not evident, but the dentist can easily make it out when by seeing the bite inside itself that they have a tendency for growth like this. So at that time, what he needs to do is a small cup, a chin cup. This is called. This is just like wearing a cap, and you have to wear it only when you are at home. Okay, I'm not saying that all such cases should be treated with this appliance only. It depends upon, we'll have to take the x-rays and all and decide. But this is one really harmless cap-like thing which you have to wear only for 10 to 14 hours a day. Okay, and when you go to school, you don't have to wear it, and the correction that you get is awesome. So there are such treatments that are available. The only thing is kids are not aware that such things can actually help you, and usually by the time they come seeking treatment, the growth period of the child is over. If this child is allowed to grow in the same way, he comes out with a really jutting out lower jaw, and at 16 years of age he seeks treatment. There is no point in wearing such appliances after the growth is completed. So what can we do to correct that? The only treatment that we would have at that particular time would be surgery along with braces treatment, a facial surgery along with braces treatment. So by wearing these appliances, what you are actually gifting the child is a freedom from that particular, facial surgery in future. Okay. Even after he has grown, we can correct it, but yes, different surgeries they might require. Coming to braces treatment, the proper braces treatment, which we would actually start only after all the permanent teeth have erupted. Suppose the complaint is only dental malalignment. That means the teeth are crooked or out of place, out of arch, etc. There is no much skeletal problem or bone problem or jaw jutting out kind of problems for the person. We have the braces treatment, which is a common sight. So what are the treatments available? You have metallic braces, in which these small blocks that you stick onto the teeth are called braces. They can be made of metal or they can be made of ceramic, which is tooth colored and which is very, very less obvious. So if you are an adult, it's not that you should do braces treatment only from the age of 12 to 16 or 18 years. Even if you're 50, you can go ahead and do your braces treatment and align your teeth. But like for adults, they might be a little skeptical about and a little worried about having this metallic smile at their workplaces and walking around, etc. So we have the options of ceramic braces. You can meet your dentist and speak about that. If you don't want to wear that, also a beautiful system called as clear aligners you have. Okay, these are just clear, transparent U-shaped trays which snugly fits onto your teeth. It looks like as if you have laminated your teeth. See, I have a comparison of the normal braces and the clear aligners here for you. Nobody can make out that you're undergoing braces treatment, even if he's sitting 1 feet away. That is the comfort of this system, and there is no projections which will actually hurt your inside of your lips and your cheeks. So, and when you are having your food, you can remove it and keep it and have your food with like and very comfortably. You can, there is no food restriction, you can eat whatever you want. Now these are all the advantages of the system. Now, disadvantages is that some complicated cases we might not be able to do with it, and certainly it is a dentist who has to decide whether a clear aligner system will be feasible for you or not. If yes, even for adults, this would be the treatment of choice. If you don't want the braces to be seen outside, there is a system wherein we can stick these braces on the inside of the tooth, and it is called lingual braces. So there are lot and lots of tooth alignment systems that are available. What you just need to do is take a consultation with your dentist, and he can actually change your smile and through that your life. Now, the most common complaint a patient comes to a dentist with: toothache. Now, why we would stress on this toothache? If we were to judge which is the most severe pain to bear by a human being, I would say it would be either the delivery pain or a final stage malignancy pain or a heart attack. These three are the pains that is the maximum a human being can endure, or comes across in his lifetime. The rank 2 goes to two pains. That is, one is earache, which is also extremely severe, and the other one is tooth pain. The tooth pain. So what is this tooth pain? Why does it hurt so much? Just let's have a look at the tooth. You have enamel on top, then this yellow portion, what you see, like in this fibers there, it is called dentine, which actually makes up the bulk of the tooth, and inside there is a space. Enter. Okay, that portion of the tooth that is seen in the mouth above this line is called as a crown, and whatever is under the gums we call the root. Okay, so through a small opening at the tip of the root, through a canal inside the root, it comes inside, and all this blood vessels and nerve plexus is there inside. And this space or this tissue together is called pulp. Okay, this is the actual live portion of the tooth where you have blood vessels and nerves. Okay, now there is a small decay that is starting here. Okay, at this time you could have gone to the dentist and just got that filled. It goes a little more deeper and you start getting little bit of sensitivity. First you'll be having cold sensitivity. When I have cold water, it comes, some say it pains, some says there is sensitivity, etc, etc. But and even then you don't go to the dentist. What happens is that slowly goes deeper and starts affecting. Before the bacteria actually reaches here, the acids of the bacteria can affect the pulp. So once inside here, you have your blood vessels and nerves. Once this infection reaches the close proximity of the live part of the tooth, that is when the toothache pain actually starts. Initially, it is during the night time, and slowly as it progresses, it becomes a full-time event. Okay, now what happens is, like in any body, when there is any part of the body, when there is infection, there can be a small swelling, but your tooth cannot swell. Your tooth cannot swell, it's a hard tissue. So what happens is that all the edema fluid that collects as a part of infection, what happens, it starts crushing your nerves inside. So that's why the toothache is so excruciating a pain. So ladies and gentlemen, it is always better to avoid this pain rather than to treat it. Okay, so this is just another schematic diagram. It looks a small decay, but once inside it spreads laterally and becomes a big one, and it goes and slowly affects your pulp. Okay, so if now what causes a tooth decay? How can I prevent this? What causes a tooth decay is that there is tooth there are sugars in your diet. Okay, there are 4 causes. A decay is called as a multifactorial disease. It is a bacterial infection. Okay, it's the bacteria causing that disease. It is an infection that happens on the hard structures of the teeth, enamel and dentine. So for the decay to occur, 4 things should be there. Then only decay should occur. If any one is removed, we can prevent the decay. So in order to know how to prevent decay, we need to know what are the 3 or 4 things that we need to remove. Okay, the 3 factors. One is a tooth. Tooth in the sense, I'm not telling you to remove the tooth, the susceptible tooth for decay. That means this is where our genetics comes a little. If your mother has a lot of decay, you also would have a tendency to get a lot of decay. That is because of the tooth form. The tooth can have really deep grooves where food can stay. Okay, in such cases, if you're meeting the dentist on time, as earlier I told you, pit and fissure sealants and sealants like that at the initial stage itself fill the tooth, we can maintain. Okay, so tooth is one factor. Second is sugars in your diet. Are you having a good diet? Okay, it is the food that the bacteria wants is sugar. The food that the bacteria wants is sugar, especially sucrose or easily digestible sugar, which is abundantly available in our junk food. Okay, and now if you eat the sugar, what happens is that your mouth pH goes a little down and bacteria can easily act. And the third reason is bacteria. Of course, now when you compare 2 people, you can always say that maybe every person has bacteria in the mouth. Now, what kind of bacteria is more in you is what matters. So for some people, the amount of staining bacteria might be more, so they will have a lot of stains in their mouth. For some people, it might be because of the bad breath causing bacteria, which gives them a slightly bad breath. For some people, it might be gum disease causing, and for some people, it might be decay causing bacteria. So this is not actually in our hand. We cannot keep on having antibiotics our entire life. But what we can do is either change your diet, take care of your teeth, and the most importantly, what is there in our hand is time. What I mean by time is all these 3 factors. Okay, sugars sitting on a tooth with bacteria around. If that is present for a long time, that too for days to come, then only the decay will start. So if your tooth cleaning habit or tooth brushing is very timely, that means every day morning and every day night you're cleaning the tooth and not letting the sugars stay on that susceptible tooth where there is bacteria, we can easily manipulate this time. If we don't let the sugar stay there, that bacteria, when decay will not start in the first place. So though the dental decay is the second most common infection in the human race, this is one disease that can be prevented, provided you understand. So the frequency of tooth cleaning, morning and night brushing, and more importantly, brushing at the night is very, very, very important. Okay, as you age, along with brushing, you need to do dental flossing as well. So how do you treat this decay? It can be by removing the decayed portion of the tooth and filling it with many materials. We have metal fillings, we have tooth colored fillings, which exactly looks like the tooth. Nobody can make out that you have done a filling there. It can be done with a material called composite, or it can be even done with porcelain, okay, or ceramics. Even the front tooth that is chipped and broken and all, which is prone to have large bacteria as well as food there, and like, you know, you leave it like this, it is going to hurt in future. So such chipped or cracked teeth also need to be restored. Okay, so this is what the treatment would be. And in case we don't go on time and the tooth becomes painful, what should you do? Go pluck it out? Definitely not. There is still, if you can just retain the tooth, eliminating only the pain, then you should do that. No? So what you should do is, suppose the decay is gone and there is infection and there's a lot of pus, etc., etc. What you need to do is do a root canal treatment for it. What is root canal treatment? Root canal treatment is a treatment to relieve your pain. It relieves pain. So how does it do? You have to make, the dentist makes a small hole in your tooth and only the infected pulp he removes. Rest everything, your enamel, dentine, everything is preserved. Your tooth is preserved. Once the pulp is removed from the root tip, they're going to fill it with different materials, and on top of that later give a crown. Either a crown or some special fillings similar to crown that the dentist will decide, so that the tooth can be put back to function. So these are pictures of crowns for you. This is like, you know, a tooth colored crown in the front, on top, and inside you have actually a metal coping. That's called a metal ceramic crown. If not, outside, inside, everything white, really beautiful metal free ceramic crowns are there. So like this, you need not have a crown, you know, mandatorily for all the root canal treated teeth. Some teeth can go with special fillings also. That is up to the decision of the dentist. Now, suppose you don't do root canal treatment also, it's severely painful, and you take out the tooth. What are the consequences of tooth loss? Why I should bother about whether my tooth is there or not, especially if in the present crowd, what I see is, if it is a behind tooth, I'm not bothered. If it's a front tooth, they'll come running. If it is a behind tooth, they're actually not bothered whether to replace it or not. So what happens when you actually lose a tooth? Okay, the tooth that is behind and the tooth that is in front can drift to that space. The opposing tooth can slightly tip down, come down. This is what happens. Tipping of all the adjacent teeth, opening up of gaps in between the teeth of the same side as well as on the opposite arch. This tooth is gone now. See, it has come out of the bone. He doesn't have anybody to bite, so he's coming down in search of somebody to bite. So what happens? This opens up gaps in front of, in between all the teeth. You can get decay here, everywhere. And what was a small decay in one tooth here, okay, this is what we say, a stitch in time saves 9. If you had just filled that decay, all this could have been prevented. We didn't do that. We didn't do a root canal treatment. We pulled out the tooth. We didn't replace. Years went by and this happened. And this is just not a dental problem. Later it can become a joint problem as well. If you have multiple missing teeth, okay, the way you close your mouth, the like in the path of closure, etc., can change, which can put extra stress onto your joint, and you can start getting joint pain, arthritis kind of pain and all, which would make you do, will compel you to do several, severe kind of, you cannot call any treatment severe, but more complicated kind of treatments. Okay, now let's come to, suppose we are ready to replace a tooth. What are the options? The best option that you can have to replace a single tooth is an implant. It's called a dental implant. It's nothing but a small fixture that is fixed into the bone from where you have lost a tooth. Okay, this dental implant stays there just like the tooth root. And on top of that, you have another attachment that can be fixed that would look like a small tooth. And on top of that, a normal crown is placed. So after that is placed, it just functions like a normal tooth for you. So that is the most efficient way of replacing a single missing tooth. Now, of course, whether it can be done on you depends on your medical status as well as your bite, the amount of distance that is left, and the quality of bone, and so many different things, which is left to the dentist to decide. So ideally, within a month or within 3 months of losing the tooth, you should be thinking of a permanent replacement. Now, if you cannot do an implant, the next option that you might have is a bridge. Suppose one tooth is missing, we slightly shape the tooth in front, the tooth in back, tooth behind, and you get a cap or a crown for those two teeth, and the tooth that was missing is welded onto that. So just a 3-unit tooth-like bridge is cemented onto these two teeth. And after it is cemented, it just looks like as if you have all the teeth. The missing tooth is there, is not realized. Okay. Now these are the two options with which you can have a fixed tooth. One is an implant and one is a bridge. If you don't have that, we have removable appliances in which only the teeth that are missing that can be replaced, and rest wherever you have your teeth, this denture actually hugs around those teeth and clings onto your jaws. Okay, this is called a removable denture. It can be made with different materials. This is a normal a rigid denture, and this is a flexible denture, and you have removable dentures which can be made on metal frameworks as well. So don't go toothless. If there is any tooth that is missing, please meet your dentist. It is important that you replace them. Otherwise, you can have severe problems in future. Okay, if you don't have any teeth also, there are full dentures that you can wear. This is for the elderly crowd. Full dentures, the kind of treatments or the dentures that are available at present with the present technology, they are pretty comfortable. Only thing from complete dental apparatus, the natural teeth that you had, when you come to a complete artificial bite, there is a small learning curve. You need to know how to chew with these and all. But once you are accustomed to that, it is just like you wearing your spectacles for the first time. Initially, it is like you feel a little cumbersome. After some time, it becomes very, very convenient for you to do so. Okay. Without this, it wouldn't be, you wouldn't feel like going out even or doing anything even. So it becomes a part of you. So these are appliances that can help you, like in case you have one tooth or multiple teeth or all teeth that are missing. Now let's come to the health portion we saw, the function portion we saw, and now let's come to beauty. What all has dentistry in store for you to make you look a little more pretty? Okay, slightly darker teeth you have, please do not worry. There are different ways in which we can make it white for you. There are simple tooth whitening procedures, in adjunct with lasers we have, or you can actually, the way you put artificial nails on your fingertips and make it look beautiful. There are some ceramic shells that can be fixed onto your teeth, which we call dental laminates or veneers, with which we can actually change the color, the size, the shape, and the natural beauty of the tooth. These are cosmetic things that can be done on your teeth. Ceramic or composite veneers can actually alter the shape, size, and the form of the tooth also. The small gaps, etc., can be filled in such a way that you see this picture. Does it look as if he's done or she's done something artificial on it? Absolutely no. So this is a small gap that is filled. Okay, and this small tooth, we have enhanced the corner of the tooth. Here also we have enhanced the corner of the tooth, and yes, Shazam, she gets a big makeover on her smile. So if you see, actually the person's personality itself changes when we do small changes like this. If suppose this gap was there in between all the teeth, the amount of change that the person would have in his smile, this would be just awesome. Okay. Now, this is something that you might not be aware of. There is something called as tooth jewelry as well. Okay, wherein we can put certain crystals onto your teeth. It is trending. Okay, so this is possible. Usually the brides come, or TV anchors, etc. They come to us and we select the light reflectance points of your teeth to fix these jewelry, and it is a fancy thing. So that is it. Let me stop sharing. Okay, so I have just thrown light to a few things that you should be aware with regard to what dentistry has in store for you. What dentistry has in store for you. So it is. I hope I have given you some things to ponder about. Something that might be there in your mouth or in your kid's mouth that needs attention. Please go to a dentist. They are there. So when or how frequently should you go to a dentist is one question. The answer is once in 6 months. Why once in 6 months? Once in 6 months because I told you the most common problem, the dental decay. The dental decay, the average time the bacteria takes to traverse from the tip of the enamel to the pulp, or to the average time it takes to make it symptomatic for the patient is 6 months. I'm not saying always 6 months. For some people it may be faster, for some people it might be years, but the average time is 6 months. That means every 6 months if you're meeting a dentist, there is every chance that you can catch the worm early. That means we can treat it at a filling stage. You don't have to go to a root canal, or you don't have to go for crowns, or or the trauma of tooth loss in future. And it is always better that you get a dental cleaning done every 6 months, okay, because that helps. See, the studies have proven that a person who does dental cleaning judicially every 6 months is extending the life of his teeth or his set of teeth by more than 5 years. Okay, so it is in the what we call tartar that adheres to your tooth structure. That is where the maximum amount of bacteria lodges in your mouth. And if you periodically remove them, it is good not only for your dental health but also for your general health and even cardiac health. Okay, so there are a lot of implications with regard to tooth or the mouth is as much a part of your body as much as your eyes are, or as much as your heart is, etc., etc. So it is mandatory that the god given oral apparatus has to be kept healthy, in function, and beautiful. So I'd like to end my talk there, and my sincere thanks to the Prayaana group for having given me this opportunity. And I'm open to questions if anybody would want to ask me some.
Hi, ma'am. So we have a question. So
Yeah.
basically, when we go for braces, they ask us sometimes based on the case complication, they ask us to extract teeth. So will it affect our health? Any chance like extracting two or
No, definitely no. This is one premonition that many people have. Like many people have told me that if you pull out the teeth on the upper jaw, won't it affect your brain, etc., etc. And if you pull out the teeth on behind, won't it affect your ear, etc., etc. There is no actually physical connection between the nerves of your tooth and your brain, etc., etc. So see, why the dentist asks you to take out teeth for braces treatment is, see, for example, imagine some five people traveling in an auto rickshaw. At that time, what happens? One person sits behind, one in front, one behind, one in front, like that. So same way, if you have a small jaw and lot of teeth, okay, one will be in front, one will be behind, like that. So they stay like that because there is no space in that auto rickshaw seat or in your jaw for all the teeth to align properly and sit. So what we need there is space for the teeth to align and properly and sit. So there are different methods in which we can get space. Either you have to slice a little by a little of all your teeth, or not so important teeth from behind you have to remove. And after that, align all the remaining teeth in such a way that once the treatment is over, there is no gap. So that is what the orthodontists do. Okay, even I personally have done that treatment. There's nothing that has happened to me. So, and we do it on a daily basis. So all this is the fear in the mind of a person that if you do this, it happen. Doesn't. Please meet your dentist and clear your doubts like that.
Thank you so much for this informative session, ma'am. Now we are coming to feedback. We would like to hear both positive and negative feedback. So please leave your feedback on our YouTube channel and we'll get back to it. For advertisement and sponsorship, mail us at joinprayana@gmail.com. So tomorrow's session is on the topic Penny Wise, Pound Wise, Baby Steps Towards Financial Freedom by Mr. John Joseph. And this is the schedule for the upcoming sessions. On Thursday, we have a session on Know It to Fight at Diabetics by Dr. Sajali T.S. And on Friday, we have a session on using psychodiagnosis and psychometrics assessment for personal and organizational growth by Chandra Vadhana. And on Saturday, we have a session on being the new age parent by Ms. Pooja Bose. Thank you so much for watching. Do subscribe our channel. And if you like the video, share it with your friend. Thank you so much.
Thank you.